Taking that very first step toward getting help for alcohol dependence, wow, it can feel like a huge, maybe even impossible mountain to climb. But what if I told you there was a way to start that journey? A path that doesn't mean you have to put your entire life on pause. Today, we're going to talk about a really hopeful, effective, and safe alternative that makes recovery so much more accessible. Look, if you're feeling stuck or just totally overwhelmed by the road ahead, please know you are not alone in this. That feeling is completely understandable. But the most important thing to remember right here at the very beginning is that there is a safe way forward. There is hope, and help is available.
So what is this different path I'm talking about? What does it actually mean to get help without having to check into a facility and stay there? Let's just break it down. Okay, so in the simplest terms, ambulatory detox is a way to manage alcohol withdrawal symptoms safely with doctors and medical staff, but as an outpatient. And that's the key part. It means you get the care you need during the day, and then you get to go back to the comfort of your own home at night. This approach lets you keep up with your daily life, your job, your family, all those responsibilities. It's a really powerful difference when you compare it to traditional inpatient detox, which asks you to hit pause on everything to live in a facility. So instead of taking you out of your life, ambulatory detox integrates recovery into it. Now, of course, this brings up a super important question, right? Is this the right approach for everyone? We need to take a look at what makes someone a really good candidate for this. You see, this is a carefully considered medical decision. It's really designed for people who have mild to moderate withdrawal symptoms. And having a strong support system at home, that's huge. You need a responsible person there to help monitor how you're doing. And this is critical. You have to have a plan to continue with a formal treatment program afterward. This isn't for those with really severe symptoms or other major health issues. For them, an inpatient facility is absolutely the safer, better choice. Okay, so the next logical question is all about safety. How can this really be done safely outside of a 24/7 facility? Well, the answer is all in the process. It's highly structured and medically sound. The best programs, the ones that are truly successful, are built on a rock-solid foundation of safety and structure. It all starts with systematic screening to make sure you're a good fit in the first place. From there, you'll get a thorough medical assessment, you'll follow standardized protocols that are based on best practices, and you'll start integrating therapy right from the get-go. This is a professional, regulated medical process from start to finish. And just to really drive home the medical credibility here, the American Family Physician confirms the standard of care for what's called alcohol withdrawal syndrome, or AWS. It involves using specific, safe medications like long-acting benzodiazepines. These aren't just random pills. They are medically proven treatments designed to gently and safely ease your body through withdrawal, which helps prevent more severe and dangerous complications. So what do those first steps actually look like? Well, it begins with your full consent and a really clear treatment agreement, so you know exactly what's going to happen. Then, the medical pros do a severity assessment using validated tools, like something called the CIWA scale, just to get a baseline of your symptoms. And finally, they'll run necessary lab tests, like a blood count, to get a full picture of your health before anything starts. And the monitoring doesn't stop. It's constant. Your progress isn't just a guess. It's carefully tracked using that standardized medical scale we mentioned, the CIWA-AR. Think of it as a simple scoring system that lets your care team objectively measure your symptoms in real time. This allows them to adjust your treatment as needed, making sure you're safe and that the therapy is working every single step of the way. Now, it's so important to understand the role detox plays in the grand scheme of things. It's not the end of the road. It's really just that crucial first step. You have to remember this. Detox handles the physical side of withdrawal. It makes it safe for you to stop drinking. But true, lasting recovery, that happens in the next phase. Think of detox like a bridge. It's the thing that gets you safely from one side to the other, where a formal rehabilitation program and all the deeper work can begin. So, if detox is the bridge, well, you need an expert guide, right? Someone to help you cross it safely and with confidence. So where do you find that kind of specialized support? This is exactly where a specialized guide is so important. Organizations like RecoveryCNT, they are designed specifically for this. They offer this really personalized, kind of boutique-style care, which means you're a person, not a number. They use the evidence-based treatments we've been talking about, they integrate family therapy, and they've built a model that helps you get better while keeping up with your life and work. They provide that expert support you need to cross that bridge. Okay, so we've covered what ambulatory detox is, how it works safely, and who can guide you through it. Now, it all just comes down to taking that one brave first step. Let's just sit with this for a second, because this really gets to the heart of everything. You deserve to feel better. You absolutely can get better. The key, the secret, is just reaching out for help. If any of this has resonated with you, if it feels like this could be the path for you, please take that step today. The call is completely confidential. The assessment is just the beginning of a plan. The team at RecoveryCNT is right there, waiting to help you build that bridge to a better life. You can reach them at 1732-484-9661 or find them online at recoverycnt.com.